Good evening, everyone. On behalf of the Gurukul Global Academy, I warmly welcome you all, Ayurved learners, in today's online clinical meeting. At the Gurukul Global Academy, we are committed to our mission of building the future of healthcare. We offer more than 25 super specialty courses in Ayurved, integrating with the wisdom of Ayurved with modern science. In addition, we regularly conduct clinical meetings, CMEs, workshops, and hands-on training programs to enhance the clinical excellence among practitioners. Before we begin today's clinical meeting, let us seek the divine blessings of Lord Dhanvantari for knowledge, wisdom, and healing guidance.
नमामि धन्वन्तरीरादिदेवं सुरासुरवन्दितपादपद्मं लोके जरारुक् भयमृत्युनाशं दातारमीशम् विविधौषधीनां शङ्खं चक्रं जलौकान् दधतमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिरुदंशुकपरिविलसन् मौलिमं भोजनेत्रम् कालाम्भोदोज्ज्वलाङ्गं कटितटविलसच्चारु पीताम्बराढ्यं वन्दे धन्वन्तरिं तं निखिलगदवन प्रौढदावाग्निलीलं प्रौढदावाग्निलीलं प्रौढदावाग्निलीलम्.
For those who wish to connect with us, you may reach us via email at thegurukul@parasnathclinics.com. You can also visit our website, thegurukulglobalacademy.co.in. Feel free to WhatsApp us at 9969119134 and do follow us on Instagram, Facebook, and LinkedIn for regular updates. Next. We also have an important announcement. We are organizing offline CME for Ayurved doctors on 7th Feb at KJ Somaya Medical College, Sion, Mumbai on the topic Ayurved Management of Skin Disease. We look forward to your active participation. Next. Now moving on our today's clinical meeting on the topic clinical aspects of Shaman Chikitsa in the management of Aamvata. We are privileged to have with us today's esteemed guest speaker, Dr. Narendra Pendse, sir. It is indeed my honor to introduce and welcome him. Next. Vaidya Narendra Pendse, sir. Sir has done BMS in 1991 and has done post-graduation in Kai Chikitsa in 1994 from Tilak Ayurved Mahavidyalaya, Pune. Sir got trained under respected Vaidya BP Nanal, sir, in Pune and Vaidya VB Maheskar of Vadodara. Sir has worked as an assistant physician with Vaidya Vilas Nanal, sir, for 24 years in Tarachan Hospital, Pune. Sir has got specialized in bedside decision making to graduate and postgraduates for the last almost 30 years at Tarachan Hospital, Pune. Sir has received Best Teacher Award by Maharshi Annasaheb Patwardhan Pratishthan, Pune in 2008. Also, sir has received Karya Bhushan Puraskar by Rashtriya Shikshan Mandal in 2013. Next. Sir is a member of Governing Council at Transdisciplinary University, Bangalore. Also, sir has worked as Chief Medical Advisor to the IAIM Hospital, Bangalore. Sir has worked as ex-research committee member at Dinanath Mangeshkar Hospital, Pune. In recognition of his clinical teaching, sir has honored as Professor of Practice by the TDU as per new UGC guidelines. More than 180 guest lectures on various clinical subjects in reputed institutions in India and abroad. Regularly conducts seminars and workshops on specific Ayurved topics at various centers in India and the US for doctors and laypersons. Without further delay, I kindly request Sir to proceed with today's session. Over to you, sir.
Thank you, Vaidya Datta. Can you hear me?
Yes, sir. We can hear.
Next slide. So the basic premise of today's lecture is as per the English idiom, which says that if there is a hungry man and you give him a fish, then you can feed him for a day. But if you teach a man to go fishing, then you can actually feed him for a lifetime. So this lecture is based primarily on the thought processes which go behind defining what you decide and understanding what are the expectations of the decisions you make in cases of Amavata. Next slide. Everything that I'm mentioning to you is something everyone that
Voice. Sir, your voice is breaking.
can you hear now?
Sir, we can hear you. Only the voice is low.
Okay, I will try and increase the voice. So all of the experiences that I'm sharing are drawn from my primary experience at Tarachand Hospital. And I hope that this will help you. Next slide. And my salutations to my mentors, multiple, but most of them at Tarachand Hospital and some of them outside of Pune, especially with the V.B. Maiskar, who taught me how to find answers in the classical texts. Next slide. Next slide. So what are the, sorry, this has gone ahead. There are a few slides before this. Yeah.
Is it correct, sir?
Yes, this is correct. Next slide.
Okay. This one?
Yes. So why are we discussing the shaman aspects? Because panchakarma is not always the first choice of treatment in amawata. As students, we feel that panchakarma is the primary treatment module. It is an important treatment module, but there are multiple reasons to discuss shaman aspects. They are primarily three in number. First are the Shastriya reasons. Second are the practical reasons, Vyavahara, and other reasons. Next slide. Well, this is the classical Chikitsa Sutra, which is repeated in Madhav Chikitsa, Yoga Ratnakar, and other texts of Ayurved. So the initial emphasis is also in the first line of the sutra, Langhanam Swedam Tikta Deepanani Katunicha. The first line mentions these. And so the initial emphasis is on Langhan, which is a form of shaman. The next line is Virechanam Snehapanam. Now there are two schools of thought. In one school of thought, people consider Virechanam Snehapanam to be denoting selection of drugs like Eranda Sneha or Gandharva Astadi Eranda Sneha to bring about Virechana. However, there is another school of thought which feels that Virechan should first take place and then after arm has been removed or substantially removed, then one can use Siddha Grutas for Snehapana. Next slide. And so this is the classical Chikitsa Sutra, which also primarily emphasizes shaman, and then Shodhan is followed by shaman. Next slide. What are the other reasons? Because for panchakarma to happen successfully without causing any vyapat, it is important that one is able to render the doshas in the Madhyam Margashrit doshas back into the Koshtha. And Chakrapani says that Upasthit dosha is the only cause of panchakarma. And hence, it is very important that we start in such a way that we are able to bring about the doshas located in the shakhas back into the koshtha. Next slide. What are the other practical reasons? The cost of panchakarma is rising, which is a fact. At my institute, where I have been fortunate to contribute my services, the Tarachand Hospital, I remember that the cost 30 years ago, the cost 5 years ago, and the cost today has risen even in the last 5 years by almost 5 times. The reason being that the infrastructure costs, the cost of NABH certification, the rising cost of electricity and salary tends to contribute to the rising cost of panchakarma. Secondly, insurance is not always available so easily for panchakarma. Certainly not for cashless. So in many places, one has to pay first and then apply for reimbursement. That's why people do not easily opt for panchakarma. People also do not have lack of time and are unable to follow the parihar card and so on. People have a fear about panchakarma, perhaps based on somebody else's experiences. And there is also a lack of space in most cities like Pune, Mumbai, Nashik, Bangalore, Delhi, where the cost of real estate is so high that to have a dedicated panchakarma rooms becomes a very costly primary basic cost. It adds to the primary cost. And then getting trained staff is also difficult. Next slide. There are also other reasons why one should not immediately opt for panchakarma. If a patient is on multiple drugs, A, for the management of his amawata, or if he has any concurrent disease, then it becomes important to find out which medicines may be required to decrease, or ideally decrease the role of medicines and then gradually taper down the medicines required so that you have a finite number of medicines being taken by the patient when he undergoes panchakarma. In today's era, because of masking of symptoms due to various kinds of painkillers or drug modifying drugs or steroids, it is not always easy to understand Vyadhi and Rugnabala. And if the panchakarma is too potent, too strong, too viryavan bheshaj, then the balahani takes place and vatavruddhi takes place. And that's why one has to be cautious and assess the patient's vyadhi, bala, and assess the rugna bala by first initiating Shaman Chikitsa. Other benefit is that you get more time to interact, your staff gets more time to interact with the person. So if he is bhiru, if he is sushankitaha, you can gradually decrease his fears and make him a little more positive and more participating in nature for his treatment. Another aspect is if there are lean doshas, then one cannot really immediately start panchakarma unless the lean doshas are removed from the shakha and brought to the koshtha. If the patient has a lot of kshina mausabala, either due to bheshaj apachar or due to vyadhi karshan, even then you cannot immediately administer panchakarma unless the bala of the rugna has improved. If there is a previous karma vyapat, then we cannot really immediately start panchakarma unless that vyapat has been got over with. We have also seen at Tarachand hospitals that people who have chronic amavata, especially females of reproductive age, they have very, very low hemoglobin. And that hemoglobin can be up to the range of 3, 4 grams. And in such cases, if you administer very strong panchakarma, then it can cause harm to the patient. So balahani is aggravated, leading to ojakshay and marmabighat due to balwan panchakarma. That's why it is better to first proceed with shaman and then start or shift to panchakarma. Is it better now?
Yes, sir. Yes,
Is
sir.
it better? So how does one examine the presence of ama? A, as per lakshanas. B, as per the nadi pariksha and udar parikshan, koshtha parikshan, by the mala pariksha. Next slide. What are the variations in ama as per the hetu? The ama gunas vary, and I have given you a couple of examples. If there is madhya and dugdha together, the possibility of it leading to rasarakta dhatu dushti is more. Then you will have am, which is rasarakta dhatu ashrit. Next. But if a person is taking matsya plus dadhi, then besides the rasarakta dushti, it can also lead to meda majjashrit lean arm. So as per the hetu, as per the viruddha ahar, the ama sanchay will take place not only at the kayagni level, but the dhatu involved, the srotas involved will change. And one has to keep that in mind when one selects the Shaman Chikitsa or Shaman Bheshaj. Next slide. Now, as we all know, there are two basic descriptions of amawata. One is the samanya avastha and other is the pravruddha avastha. If you look at the description in Madhava Nidan, then the samanya lakshanas can be attributed to dushti of 6 srotasas mentioned in Charak. But if you look at the pravruddha avastha, it involves all the ukta srotasas mentioned by Charak. And depending upon how many dhatus and how many srotasas are involved, the chikitsa will change. The shaman will change. Next slide. This is just a guideline as to what can be given. This is not an exhaustive list. I'll speak about some of these in the next few slides. But as you will see, you can have ahar, ekeri vanaushadhi, vathakalpana, churna kalpana, bhasmas, rasaushadhis, siddhaghrutas, tailas, and asavarishtas. So all of this can be used, and we'll see how one can decide and define what choice is to be used. Next slide. So these are the reasons and these are the variables which will decide which shaman option is to be used. A, shaman is useful, as we have seen earlier, both in samanya as well as pravruddha amavata. Other important thing is that as per cause of ama, you can change the Shaman Chikitsa. And I will share some examples with you as we proceed. The number of dhatus, and first, very important to understand whether the arm is lean or not. The rule of thumb is if a patient has chronic amavata more than at least 1 year, then the arm is very likely to have leenatva. If a patient has been taking lots of allopathic medications or has been indulging into self-treatment, then arm can be rendered lean. It is very important to assess how many dhatus and srotasas of the Ukta 13 srotas are involved. Is there any Vyadhi Sankar present? What is the concurrent treatment being given? All of these matter, and based on these variables, one should decide which Shaman Chikitsa is to be opted for. And I'm sharing some of the examples in the next few slides. Next. I'm sharing before you 4 possibilities where it can be a Jwara Pradhan presentation of Amavata. It could be a Snayu Graha Pradhan, which will involve the Mausa and the Medovah Srotas. It could be Grahani Vyadhi Janya, which is Anna Purishavaha predominant Srotas involvement in the Samprapti, or it can be Shotha Pradhan, where Rasadhatu or Rasabha Srotas will be primarily affected. Now, based on either the presentation of Lakshanas or the Hetu, your choice of Shaman will change as per the Srotas guidelines. Let's see some of the examples. Next slide. For example, if the presentation is Jwara Pradhan, then you have to use the Chikitsa Sutra of Amavata and also as per Jwara. In both the Vyadhis, Langhan is the treatment of choice for Navajwaraha as well as Amavata. Then one has to put the patient on complete Langhana or Sanskarita Ahara. And then it can be of various types, and that I will share with you in the coming few slides. As an example, it could be Shunti Siddha Jala, or it can be various kinds of other dravyas like Panchakol Siddha Jala, Pippali Siddha Kshira, or Shunti Siddha Kshira, and the drug of choice can be Tribhuvan Kirti, Mahasudarshan, Amrutottar Kashayam, Mrutyunjay Ras, Lakshmi Vilas, Mahalakshmi Vilas. So if the presentation is Jwara Pradhan, then the choice will of Shaman will keep both factors in mind. The Amavata Chikitsa Sutra as well as the Jwara Chikitsa Sutra. Next slide. If the presentation is Snayu Graha Pradhan, then, as I mentioned earlier, the Mausa and Medovah Srotas, Dushti, is present, and such cases will not easily respond. Incomplete Upashay cannot be gained by only Langhan or only Bheshaj. In some of these cases, where the chronicity is too high, the patient may require Shastra Karma. You may be able to avoid Shastra Karma in multiple sandhis, but the patient may require Shastra Karma in the Janu Sandhi or in the Amsa Sandhi if the Vyadhi has affected that Sandhi for a longer time. You can use Agni Karma or Viddha or Lepa or Pichu Dharan, but all of these will give you symptomatic relief. They may not be able to give you complete Vyadhi Prasham. So, based on your clinical judgment and the presentation of that particular case of Amavata, your treatment choice should change. We use a lot of Agni Karma and Viddha Chikitsa at Tarachand Hospital. Datta Bagpardekar has seen that. But that will give you, even Jalao Kavacharan, but that will give you Lakshan Mukti. It will not bring about complete Samprapti Bhanga. So those limitations should be known on day one. And that's why clinical presentation and your clinical evaluation of the person by touching his nadi, touching his body, examining each and every joint, making him make movements of that joint is very important. Otherwise, you will be misleading yourself as well as the patient. Next slide. If you look at, as I mentioned earlier, as per the Hetu, if a person has had, say, Vataja Grahani Pradosh, which is very commonly seen, or Kafaja Grahani Pradosh for a very long period of time, resulting into Amavata at a later date, then the Chikitsa Sutra for Shaman will follow both the Amavata as well as the Grahani Chikitsa. In such cases, Ahar will play a more predominant role not only in the beginning but throughout the Chikitsa Kalaha. And then Kalpas to be chosen will keep in mind the fact that the patient has a history of Grahani Pradosh, and so the choice would be, say, Chitrakadivati, Agnitundi for Vata Kafaja or Kafa Pradhan Samprapti, and Yavanyadi Churnam for Vata Pradhan Grahani Pradosh or Vata Kafaja Grahani Pradosh. Now, please remember that Yavanyadi Churnam is also present as a drug of choice in many Vata Vyadhis, and it is something which is used very commonly in the southern tradition for Chikitsa of Vata Vyadhi, including Amavata. Similarly, after basic Amapachan has taken place, either for increasing Dhatuvagni and Kayagni both, as well as for Rasayana, one will have to choose later medicated Siddha Grutas like Shir Shatpal Gruta or Shunti Siddha Gruta given in Chakradatta. Now, these formulations, the choice will be known to you from day one because you know that the Nidan of the patient which precedes Amavata was Grahani Pradosh. So, I have given you both examples of presentation as well as Vyadhi Udbhav. Next slide. If a patient presents and multiple patients of Amavata present with Shotha Pradhan, now you will have to incorporate the Chikitsa Sutra of both Amavata and Shotha. So, Sanskarit Ahar will be common, but then Kalpas like Vardhaman Guda Shunthi, Vardhaman Guda Ardraka will come into play because these help decrease the Shoth as well as remove the arm from the Shakha and bring it to the Koshtha and eliminate it from the Mahasrotas. In my personal clinical practice, I have used Vardhaman Guda Shunthi, Vardhaman Gudardrak, Vardhaman Guda Bhallatak, Vardhaman Guda Punarnava, and Vardhaman Guda Haritaki in cases of Amavata. Of course, kalpas like Punarnava Mandur, which are commonly used both as tablets as well as Punarnava Leh, which is prepared by some of the South Indian Kerala-based companies, are both effective. So depending on the kind of presentation of Amavad that you have and the kind of Hetutva that you find, the Shaman Chikitsa choice will change. Next slide. So this is the classical Amavat classification of Samanya and Pravruddha. However, the classics have also referred to Doshanubandha, which is missed in day-to-day clinical practice. And as I mentioned earlier, even in Pravruddha Avastha, you have to further understand how many srotas and how many dhatus have been affected in the patient sitting or walking before you. Next slide. Another classification based on clinical experience as well as Jwara Adhyay is to define Amavat as new presentation, which is within 1 year, and older presentations, which have either only Ayurvedic treatment for more than 1 year or multiple treatments for more than 1 year. Depending upon the chronicity, the treatment choices will change. Because as the Amavad disease becomes more chronic, the Rasavaha Srotodushti becomes more predominant, and the ability of the Rasa Dhatu to bring about ocean of the Uttarottar Dhatu is compromised. And eventually, the patient may have either Shot or Apakarshan, but he has a loss of Balam. Certainly, Mausa Dhatu Balam, Agni Balam are both reduced. So, in that case, Uttarottar Dhatus and Dhatuvagnis are affected due to the chronicity of the patient disease. Also, some drugs affect his Srotas. If a patient has been on steroids for a long time, it is known to bring about immediate relief in the presentation, but is known to cause long-term affliction of his Medo Dhatu and Asthi Dhatu. In such cases, you will have to use Vardhaman Gudashunthi and eventually put that person on some Suvarna Kalpas, which I am mentioning later, so that the Vyadhi Balam or the Srotodushti which has taken place due to excessive drug usage is reversed. Next slide. Next slide. Yeah. So as I mentioned earlier, in patients who have less than 1 year presentation, then usually only Amawata Chikitsa Sutra is adequate. But if the Vyadhi presentation has multiple complications, then you have to use Shaman predominantly, prepare the body to undergo panchakarma and then administer panchakarma. It is my very, very regular, unfortunate experience that I see multiple cases properly diagnosed as Aamvata who have received multiple sessions of Vaitaran Basti or Kshara Basti, which are very, very potent Basti Kalpanas given in the Shastra, have been already administered to the patient. But over a period of time, such Balwan Basti Chikitsa has resulted into depletion of Oj, Bala, Rasadhatu, Mausadhatu, and eventually Agni. In such cases, it is my opinion that perhaps if you have a patient who has already undergone Tikshna Shodhan and the disease does not seem to have reduced, you need to go back and check his Nidan and not administer Vaitaran Basti or Kshar Basti just because it is mentioned in the text. If the dhatus are lean, then Kshara Basti, Vaitaran Basti will give you only symptomatic relief for a very short period of time, but eventually it aggravates the Vata, and that aggravation of Vata is due to a Balwan Upakaram like Basti. So such Tikshna Upchar should be done with cautious. You need to first build up the Balam of the Rugna and use it under supervision. Otherwise, you can unknowingly cause harm to the patient. Next slide. For example, if the Amavata is of a very chronic nature, then the Chikitsa Sutra of Jirna Jwar, where it says, Daurbalya Deha Dhatunam Jwaro Jirnanuvartate, comes into play. In such cases, you have to focus on decreasing Dhatu Daurbalya by using various kinds of Shaman Chikitsa, especially Rasaushadis like Hirak Bhasma, Suvarna Bhasma, or if a patient is not affording, then Kalpas like Lakshmi Vilas, Mahayogaraj will be required. Next slide. Now, what happens in chronic Amavata patients? This is a sutra from the Vata Vyadhi Nidan. But very commonly, all of these complications are seen in patients of chronic Amavata. And I'm very sure that those of you in the audience who have seen multiple cases of Amavat will find a name before each of these Lakshanas, which you must have experienced in your clinical practice. Please remember that as per Charak, Madhav Nidan, Sushrut, Kshina Mamsa Balam is a very, very important factor. And in most patients of chronic Amavata, Kshina Mamsa Balam is usually almost always present. In such cases, please proceed with caution with panchakarma. Start with Shaman, bring about relief, improve the Kayagni and Dhatuvagni, and then proceed to panchakarma. Next slide. I am listing before you some of the kalpas. Hirak is useful for Sarvadhatu and Bhutagni Mandya, and for Balwan Sama, lean dosh. Because the Shastra says that it is Sarvotkrishtam Rasayanam. Besides, it is Rudyam. And when there is Vyadhi Sankar, then this becomes a treatment of choice, though it is very expensive. Eventually, you can use Sukshma in various forms, but it is a drug of choice. Next slide. And it is also Vividha Amayagnam. So, it also improves the Rugna Balam in a shorter time frame than other kalpas. Next slide. Next slide. Yeah. Now, in Suvarna, the property as per Ananda Kanda is that it is Vishadoshaharam. Now, some of the drugs which are routinely used for Amavat in allopathy are Vishasadrush if used without any supervision or used for a very long period of time. In many cases, I have seen that a rheumatologist treats patients far superiorly than a general physician. But in most rural places or tier 3 cities in Maharashtra as well as elsewhere in India, the proper rheumatologist may not be available. In such cases, rampant misuse of medicines does take place, and this is something reported by allopathic journals also. And in such cases, that kalpa, which is being used from modern medicine pharmacology, eventually acts like Visham. And hence, kalpas like Suvarna have to be used for such cases, and it is useful for Sarvadhatu Bhutagni Mandya and Leenatva and Samata, especially Samdosh. Next slide. Abhrag Bhasma Shataputi is a kalpa which is prepared by many companies, and it is Falashruti itself. It has been said, Amlapitta Amavatadi Roge Syad Gajakeshari. And it is something which is useful, especially when there is involvement of Pranava Srotodushti as well as Pranadushti. And you will find that due to Vyadhikarshan, patients suffer from Prana and Udana Dushti Lakshanas also. In such cases, Abhrag Bhasma becomes the drug of choice. Next slide. Kalpas like Vata Jintamani Ras. This is something which the Deha Dhatvagni Vijnan book written by Haridatta Shastri mentions his experiences of using Brihatva Chintamani in cases of Amavata. And you can use all of these kalpas, which are very expensive, for a very short duration of time to bring about initial response and upashay by using proper shaman. Eventually, you can gradually taper off such expensive medicines because most patients cannot afford this. What happens if a patient is unable to afford such kalpas? I am moving on to cheaper kalpas in my next few slides. Next, Rasa Sindur, especially for Kapha Pradhan Samlin Dosh and for Balwan Oja Rasa and Prana Dushti, one can use Rasa Sindur, plain Shadgun Balajarit, or Suvarna Sindur, that is Makar Dhwaj. Next slide. Next slide. Next, Panchatikta Gruta Gugul, especially for Balwan chronic Aamvata, where Majja Medashrit arm is present, then Panchatikta Gruto Gugulu is the drug of choice. Please remember that most pharmacies, when they prepare Panchatikta Gruto Gugul, due to storage issues, they tend to use Gruta in a lesser quantity. Otherwise, if you use it in the whole quantity, the Gugul tends to have a coating of Gruta on it, and if kept in storage for a long time, it smells bad or it becomes rancid, and hence most kalpas of most pathas of Panchatirtha Gruto prepared by most pharmacies are very drying in nature. It should ideally be a Snigdha Kalpa. What I usually choose to do is either prepare that which I have done under my supervision, or use Panchatirtha Gruta Gugul in a Gruta form. Nowadays, capsules are also available. Next slide. Abhayadi Gugul, which is from Bhaishya Ratna Mastishka Chikitsa, for Majja Snayushrit arm, especially again in chronic Aamvata. Next slide. Mahamrutyunjay Ras is something which can be used for doing both Pachan. After Pachan, it helps remove the lean dosh. Initially, if there is Balwan arm and dosha sanchay, it leads to multiple Virechan Vegas, but eventually, as the arm is reduced, the same person does not suffer from so many Vegas. The Vega Sankhya goes down, and then gradually you can make it once in 2 days, once in 4 days, so that dosha shuddhi keeps on taking place. Next slide. As I said, I will mention kalpas which are also very cheap. I regularly use Vardhaman Pippali, Vardhaman Rasona, and Vardhaman Bhallatak. Vardhaman Bhallatak was the treatment of choice of one of my teachers, Vaidya Yago Joshi, at Tarachand Hospital. And he used to have a very strong usage of Bhallatak in various formats. Bhallatak Parpati, Vardhaman Bhallatak, Guda Bhallatak, and so on. There are also other kalpas which I use regularly in non-Vardhaman form, where I usually give 5 grams, 3 grams, 8 grams of Shunthi, Siddhakshir, or 3 grams, 5 grams of Trikatu Siddhakshir, 150 ml, 120 ml, for continuous month, 6 weeks, 2 months, and that is for patients either new presentation or old, to bring about Amapachan, very useful to improve Agni, Balam, and bring about dosha shodhan, especially of lean doshas. Next slide. Please remember that one should not forget that after Ampachan has taken place and a little Balavardhan has taken place, do recommend Ahar, do suggest physiotherapy, and eventually, once Sandhi Lakshanas have reduced, exercises for muscle building, and do strongly recommend Rasayan Chikitsa. Otherwise, the patients keep coming back again and again due to Ahar Vibram or Rutu Sandhi. And also emphasize the importance to meet you or keep you in your reporting. Ask the patient to report to the treating Vaidya regularly, because just having a Lakshan Nyunata, Lakshan Laghav, does not always mean that complete Samprapti Bhanga has taken place, because in chronic Amavata, Dhatvagni Mandya and Sroto Vaigunya persists for multiple years. So please remember that you need to counsel the patient that though you might not have any complaints, please communicate with us or come regularly for a follow-up. Next slide. I think I have stuck to the time given to me. I think I took 39 minutes, Datta. So I am thankful to the organizers for starting on time, and I am much obliged that I had a very patient audience. Thank you. Over to you, Datta.
Yes, sir. Next slide. Okay, so if anyone has any questions, please put in chat box. We have already received some questions. Next. 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 Sir, one question is received that what panchakarma procedures in Aamvata patients can we do at home procedures in chronic stage? Sir, you are mute.
Well, thank you. It is not panchakarma per se, it is purva karma,
Okay, sir.
but regular abhyanga and swed is very, very important, plus mobilization of joints. One of the kalpas or treatment panchakarma procedures, which I teach patients at Tarachan as well as my private practice, after they have reached a stage where arm is not present and you have to correct the Dhatvagni Mandya and the Sroto Vaigunya, I usually teach them how to take Guduchi Siddha Kshir Basti in the hospital under supervision and then train them to take it at home. Siddha Kshir Basti of 120 to 150 ml can be self-administered or can be rendered by the patient's relatives at home. Of course, you have to warn them of the doshas of taking Yapan Basti for a long time, Agni Mandya, Shot, and so on, and ask them to periodically come in so that the Vaidya can check for himself whether any Vyapad is happening due to rampant usage. But otherwise, these kalpas can be done at home. If a patient has good Bishak Vashyata and is Jnapak, then using Siddha Taila Matra Basti at home is also something which I recommend. But this depends upon the Bishak Vashyata and Jnapakatva of both the patient as well as his relatives. Thank you.
Thank you, sir. So next question is kindly elaborate avastha of Yapan Basti in Aamvata patients.
After Amapachan has taken place, after Kayagni Vruddhi has taken place, and you find that it is now predominantly Pravruddha Vata and Sroto Vaigunya, especially in the Majja and Asti Dhatu, then as a Rasayan, you should use Yapan Basti.
Okay, thank you, sir. So next question is how to identify the avastha of Gudardrak and Gudashunti. And in your lecture, sir, you said Gudardrak and Gudashunti. So can you differentiate when to use Gudardrak and when to use Gudashunti yoga?
In most patients, it is better that you start off with Gudashunti because of the differentiation of Dravya Guna of Shunti and Ardraka. In patients who have a Balwan Dosha Sanchay, Kapha Pradhan Pittanubandhi, you can use Ardra. If the Dosha Sanchay is Pitta Pradhan, Vata Kapha, then you should use Shunti. Okay, and Shunti can be more easily monitored than Ardra. I have seen that unless the patient is seen on a daily basis, Vardhaman Gudardrak can lead to Vyapad, but Gudashunti rarely does so.
Thank you, sir. Sir, next question. Can you differentiate the Aamvata patients into different desh? Like in Mumbai and other patient is in Pune. How do we think in Aamvata patients?
Well, I have had been fortunate to practice in Mumbai for 30 years every Sunday and in Pune the rest of the days. And honestly, barring Rutu of Varsha and Shita Rutu in Pune, major changes are really not seen in such cases of Amavata. Basic treatment remains the same. That
Thank
is
you,
my
sir.
personal experience.
Thank you. Thank you, sir. Next. So as we said that we have announcement for our upcoming CME on the topic of Ayurved management of skin diseases in this Saturday, 7th February at venue is KJ Somaya Medical College, Auditorium, 3rd floor, Sion, Mumbai. And our speakers are Dr. Nitin Kochar sir, and the topic would be clinical management of psoriasis. Our next speaker would be Dr. Khalid Ambekar sir, clinical management of vitiligo. And our third guest speaker is Dr. Priti Lokhande madam on Ayurved management of various skin diseases. Those who wish to join, this is an offline CME, they can contact us on WhatsApp 9969119134. Next. Now we are moving to our next session that is chaired by Dr. Sadanand Deshpande sir. It is my honor and privilege to introduce our today's chairperson, Dr. Sadanand Vittal Deshpande sir. Sir has done BAMS, MD and PhD from Pune University. Sir is ex-principal and head of the department in the Department of Kai Chikitsa, Tilak Ayurved Mahavidyalaya, Pune. Sir has huge 30 years plus teaching experience, 18 research publications, and guidance to PG and PhD students. Now I request Deshpande sir, kindly proceed. Over to you, sir. Sir, you are mute. Sir, kindly unmute.
आपल्याला बघ ना तू मंगळवारी
Sir,
भेटायचंय मंगळवारी पेपर आहे ना सोमवार
Hello.
Yes, sir. Now we can hear you. Over to you, sir.
Hello.
Yes, sir. We can hear you.
Thank you very much for calling me as a chairperson for this session. When the guest speaker is Dr. Narendra Pendse. I will say Vaidya Narendra Pendse. The Narendra Pendse's lecture is multifaceted. Not only multifaceted, it is blinking multifaceted. He elaborate all the Shaman Chikitsa of various facets of the Chikitsa in Shamana Chikitsa. First of all, let me say the one Nyaya Pindite Brahmandi. That means if you observe whatever in Jwara, you can do same treatment in other treatment which are harm is aggravated. Just like in Jwarado Proktam, Jwaramadhe tu Pachanam, Jwarante Bheshijam Daddat, Jwaramukta Rechanam. And the second stanza is also Langanam Swedanam Kalo Yavagu Tiktako Rasa, Langanam Swedanam Kalo Yavagu Tiktako Rasa, Malanam Vipakwanam Tarunam Jware. These two stanzas are very important because there is avastic chikitsa of each and every drug, each and every disease, just like a Amwat. Vaidya Narendra Pendse gives some specific chikitsa. Is there any in that also? He maybe forgot to tell us that some chikitsa is a punarbhav. What he said rightly, and the question asked on that particular what is about the condition of Gudadrak Yog or Gudashunti Yog. In now in Tarajan Hospital, one patient is suffering from Amawata Grahanigata. The stage is Grahanigata. So in that particular case, we have very good result of Gudadraka Yog, but good should be Purana good, not new good. If it in the newly manufactured good increase armor condition, it is a one comment. Second thing, the question asked about the panchakarma at home. Please do not do panchakarma at home. What Dr. Pendse said, you can apply Snehana Swedan at your home, because panchakarma is not a home best treatment. Third thing, on which condition basti should be applied. Look, in basti in amawata chikitsa, the last is basti chikitsa. These langanam swedanam kalo. This is avastik chikitsa of amvat. You can, as per avastha, you can apply this chikitsa, and lastly basti for apunarbhava. That is my special comment on this subject. The today's lecture, no doubt, the Vaidya Narendra Pendse is our consultant in Tarachan Hospital. I learn. Let me underline. I learn very much thing. Or if unable to do in any I unable to give result in any patient, I ask Dr. Narendra Pendse solve this problem, and he helped me, and we combinedly seeing that patient, and as a result patient is will become very fine or getting result. Thank you very much. Anything else, Datta?
No, sir. Thank you, sir. Now
Thank
we
you,
are
sir,
moving
for
ahead.
your comments. Thank
Next.
you. I really appreciate it. Thank you.
So we also offer some courses, the certificate course on integrated oncology. Next. Next. We also offer online course on essential gynecology and obstetrics in Ayurved. Next. Online course on essential panchakarma. Next. So our next clinical meeting would be on 26th Feb, and the topic would be Nada Pariksha, Diagnostic Aspects and Therapeutic Consideration. Our guest speaker would be Dr. Aniruddha Kulkarni, sir, and it will be chaired by Dr. Vinay Velankar, sir. Next. Now the last announcement regarding our CME. Anyone wants to register, they can contact us on WhatsApp 9969119134. We have only 200 seats, and we are about to reach our highest capacity. Next.
Datta,
Yes,
one
sir.
question.
Yes, sir.
Yeah.
I am thankful to our today's chairperson, Dr. Sadanand Deshpande, sir. I am also thankful to our guest speaker, Dr. Narendra Pendse, sir. I am thankful to our technical support team, Mr. Yash and Mr. Ayush. I am very much thankful to our listeners and Ayurved believers. I am thankful to our founder, Dr. Bhalchandra Mahamuni, sir. Thank you all for your support. I declare that today's meeting is concluded. Thank you. Thank you.
Thank you.